Another concern today at the State House was money in the budget for programs serving the elderly, especially in home care. To tell us about the message to legislators from the Mass Senior Action Council is the Executive Director, Carolyn Villers, and one of its members, Arthur Alexander. Thank you very much for being with us.
Thank you for having us.
Well, Arthur, this is not just home care you're concerned about. You're concerned about a whole host of different things.
Transportation, also early education for young people, because the sooner we start them in education, the better they'll be. In some areas, we don't have really good schools. And the better schools we have more, we invest in our schools and our teachers, then the better our kids will be educated, And that's a problem we have. Some areas, schools are fine. So other areas, the schools are not so good. We got to try to bring it all, make it equal across the board.
Carolyn, I guess the idea too is how you get money for all of these things, and some people might be wondering, why do we need to get more revenue?
Sure. I think the reality that we've faced for several years now is that the budget is just not sufficient to meet the community needs, and too often it's funding one program at the sacrifice of another. And I know that members of Mass Senior Action, as well as now more than 100 other groups, have come together and say it's time to raise more revenue, so that it's not fund one program and cut another. It's having enough money to really fund the community needs, and that's really why we are supporting the Campaign for Our Community and calling for additional revenue for the state.
Arthur, talk about the home care concerns, because this is a thing that's very important for the elderly, but it's also important for other members of their families.
Because it's cheaper for home care, and most people feel more comfortable at home.
Cheaper than a nursing home. Oh, yeah.
Yeah, much cheaper. And most people feel more comfortable at home. They live longer. See, when you're in a nursing home, it's not. See, my mother was in a nursing home for about 3 months, and we got her into assisted living. And she thrived much better, because you just waste away in a nursing home because you don't have enough activities. But at home, you got your family, you got friends. You can go and come better. It's better at home than it is in a nursing home.
Now, the way home care works, it could be something for elderly people who are living by themselves, so it's really essential for them. But I guess even if you have elders who are pretty well aged, but they're living with children who are maybe middle-aged themselves, I guess it's important for them because they need to go to work, most of them, I guess.
And sometimes you have young people that's disabled need the same care. It's not only just elderly. So you got some young people that's disabled at a young age. Like where I live, we got about 5 or 6 young people in their 40s and 50s. They need home care because they can't use their arms, or they can't walk, and they need the same thing. It's not just elderly. It's disabled as well.
And what if they don't get this care? What happens?
They'll go into, I don't know, nursing home or some other facility that don't take as good a care of them as I think, because they got too many patients, and a lot of people not properly trained in these facilities.
Carol, I mean, imagine what goes on here with this is that when you have home care people coming, if they see something that's starting to go downhill, they can catch it before it maybe requires a hospital visit or something like that.
Yeah, so the way our elder home care program works is actually there's 2 levels of care. And right now there's about 1,200 people on the waiting list for home care. And about 400 of them are actually individuals that are getting basic level of care but are qualified and are in need of the enhanced level. Those individuals are actually eligible for a nursing home, but are being cared for often by family or in the community. And so really by leaving them on a waiting list and not the services, we see a decline in their ability to take care of themselves and are at risk for institutionalization, which is not only costs more, but as Arthur was indicating, is not where folks want to be.
Talk about the revenue, Carolyn, because one of the responses I saw to a report about this rally today was that the people who pay the taxes, they're hurting too. It's not easy for them, and this is not just about raising taxes on the top 1%.
Right. The reality is that for those of us that are working and paying our taxes, that the investments that we're calling for really benefit all of us. I know my daughter is in Boston Public Schools, but there's additional fees that get passed on to parents. And as the schools get cut back, the after-school programs, the libraries, home care, all of those, it hurts all of us, and we end up coming out more out of pocket in other ways. What we're saying is that we really need to come together and ensure that our communities are strong together. And the way that the campaign, the bill that we have been supporting is designed, it does hold down those increases for most low and middle income families. So most families under $62,000 would not see an increase. A slight increase for up to $100,000. And then, as folks' income goes up, it does ask for folks to contribute a little bit more accordingly. But even, the top income earners would not be, dipping into their pockets too deeply, if you will.
When the governor was talking today, he was also talking about preschool and the importance. And I guess if you're concerned about underperforming schools, as he pointed out, this is mostly where you have high concentration of people in poverty, many with language learning needs. So I guess if you're concerned about underperforming schools, I guess this is maybe a key factor.
It is, because where I live, we have a large Hispanic population, a lot of Haitian population. They don't speak English. So we have to work twice as hard to try and get them the services they need, and that's one of the things I fight for every day. I got a translator, an interpreter, to help them understand just what's going on in their community.
And of course, if you're talking about small children, maybe the parents are working, the grandparents at home, so the only English the kids might hear is from a television set.
It's what the kids around my neighborhood call me Poppy,
They learn English from you then?
Yeah. See, because I'm Poppy to most of the kids, because I look after the kids, because I know we all have to, it's all our responsibility, to take care of the kids. All of my kids are grown, my grandkids are grown, but all children is our responsibility. That's the way I look at it. So that's why they call me Poppy, because I'm with them, I talk to them, I see they get what they need, because the parents know that as long as I'm around, everything's going to be okay,
Well, thank you both from Mass Senior Action Council, Arthur Alexander and Carolyn Villers.